Hi, Vandana and Sadhna. Thanks so much for joining us today and being willing to share your experiences and skills in knitting, especially for Sadhna. So just to introduce to everyone, Vandana is actually Sadhna's daughter. So maybe I could get you guys to share a bit more about yourselves.
Hi everyone, I'm Vandana and this is my mother Sadhna, and I am a volunteer citizen archivist and an author. I was formerly a teacher, but now I have been working freelance for the last 10 years. I was also diagnosed with breast cancer and lymphoma 11 years ago, and today I'm here to share my journey with you and see how I can support and help you.
I am a Montessori trained teacher, and I have taught in different schools for 35 years in India. I just after retirement, I wanted to do something for the society. And by chance, I came across this organization of knitted knockers who were making these knockers and distributing free. And I was very much impressed. So when I reached Singapore, I asked Vandana to help me out in getting the necessary things. And when I went to America again, I did the YouTube tutorial. And since I know knitting, I have been knitting since last, say, 70 years. So I could follow the pattern, and I started knitting in America. And before coming to Singapore, I gave the knockers, which I made about 200 knockers, to that organization only, and I came to Singapore. So here, but I wanted to do something for Indian ladies also. And Vanna found out that there is one Jayashri Ratan in South India who is doing this work. So she got in touch with her, and she was very enthusiastic about that, and she guided me, and she said she'll be very happy if I knit for her. So I started knitting again, and then started sending them to India to this lady who is dispatching to different people in India, now all over India. I am very much in it. I really am very passionate about it. And the very good thing is that at night, if I am not able to sleep, which I often don't get good sleep, I just sit and knit my knockers. So it's a very, very good pastime for me. I don't feel lonely. I don't feel agitated that I'm not able to sleep, because I'm doing the work during that time. So I'm very relaxed and very happy.
Thank you so much for sharing, Sadhna. It's really heartwarming to hear about how this actually keeps you going and also keeps yourself occupied and engaged at this period. So I just wanted to ask Vandana as well, perhaps would you like to share a bit more about how your mom supported during these 2 years as well when you were actually diagnosed?
When I was diagnosed with cancer, my parents were in the US with my brother. So immediately, as soon as I was diagnosed, we asked them to come, and they dropped everything and came here and stayed with me all through my treatment. And it was a very big help, because they became my primary caregivers. Mummy would always go with me to the oncologist and listen carefully to what he was saying. And accordingly, she made diet plans for me. She read on the internet, and she changed the way we were cooking at home so that it was healthy for someone who was undergoing treatment. So instead of spicy food, we were eating more boiled, stir-fried or baked foods. And she tried to, I'm a vegetarian also, so she tried to incorporate things that were good for me, which would increase my blood count. She read up about different treatments, which are alternate treatments, but which don't, I wasn't eating anything, but there was magnetotherapy, there was Reiki that she read about, and one doesn't know how much these things help. But psychologically, they were very helpful, supporting me in getting better. Because somewhere in my mind, I would always feel that apart from the medicine, there is some other thing also that is working towards getting me well. Also, Mummy accompanied me to every single chemo session that I went to. And that meant that she was sitting there for 6 to 7 hours with me. And at that time also, she would carry her embroidery or her crosswords or her jigsaw and sit and pass time, keep my spirits up also, keep me cheerful. Then she would go out for walks with me. I was walking slowly, but it was important for me to exercise. So we would go out late in the night when there was no one around. So I wouldn't meet people, and we would walk and exercise also. She made caps for me to wear when I lost my hair. So it was a lot of things that were happening. And I think the most important thing that my parents did was to keep their spirits up and not let me feel down. They were always with me during the day, watching television. Whatever I wanted to do, my family was with me, especially my mom. So that was a very big support.
Thank you so much for sharing. It's really nice to hear how your mom has been really a great support and backbone for you during this period of time. It really shows how caregivers really play an important role in your in recovery journey as well. So in that note, maybe would you like to briefly share some tips that you would like to share with caregivers and how they can support their loved ones?
I think the most important thing that caregivers can do is to stay positive. It's a very difficult journey because the person who's suffering is suffering, but the caregiver is well and is now drawn into a circle of, in a situation where they're taking care of a person who's not only just unwell, but maybe mentally and emotionally exhausted as well. So it's a very hard thing to do, but it's very important to keep their spirits up, to be cheerful, and to take care of the patient in a positive manner and not get flustered or pulled down by it. Another thing I would like to say is that don't get into superstitions, don't get into ideas that that this can help or stop the treatment. The caregiver needs to support, and there is no other way than to go for the chemo. All that the caregiver has to do is to be positive and not get pulled into superstitions or wrong ideas or suggest that the treatment be stopped. They need to just support and cater to the needs of the patient.
Thank you so much for sharing. Yeah, I hope that this will also be useful to the caregivers who have also attended this session as well. Yeah, so without further delay, maybe we can move on to a short demonstration where we would actually like to see Auntie Sadhna in action about how exactly you make these knitted prosthetics. So perhaps we can move on to that, if that's okay.
Yeah, sure. So actually, the knitting is done on 4 needles. So we have, Mummy has knit and kept some. So this is how it looks like when it starts. This is a sample of a small knocker as it is started on the needles. And this is how it looks. And I'll explain why the hole is there later. And then as she keeps knitting, it just gets a little bigger. And then this is how it looks. It's now a bigger knocker, almost complete, but not yet complete. And then we have a decreasing complete knocker. At the back, she's decreasing the threads and making it smaller. So you see there's a hole at the back as well. And this is going to be where the stuffing goes. I have a completed knocker here. You can see it's complete. And we are now using the hole at the back to make a filling. So knockers come in the exact size that you need. According to your bra size, it could be a 34, 35, 36, whatever you ask for, A, B, and C. And these are always given out free. So no payment is expected. This is a voluntary work that is done, and it goes into the bra like this. So it's very light, it's easily washable, and it can go in, even if you're swimming, it can go into the pool. So this is how a knocker looks like when it's done, and Mummy will show you a demonstration now. She has one piece ready and she'll knit and show you.
So now the decreasing part has started. I will knit and start decreasing also.
Is it okay, or should she stand up?
Yep, I think it's fine. Yeah, this angle is good.
If someone is used to knitting, it's not a very difficult pattern to follow. And even for a newbie, actually, it is not too difficult. It just needs a little bit of practice. There is also a crochet pattern online, and that can also be used. the important thing is to use the correct yarn, because the yarn has to be soft as it goes against the skin, and it should also be long lasting. Especially in Singapore weather, we can't use wool. So the consistency, it seems to be wool, but it's actually not wool, it's a cotton yarn. And I think mummy spends all her free time when she's watching television, even when she's in the car or she's watching a movie, her hands are moving all the time. She's knitting. For now, we are sourcing the yarn from the US and India because it's not made in Singapore. The yarn is not available commercially in Singapore.
So I guess we can also do different patterns and designs and colors as well.
Different colors can be used, but people usually prefer skin colors. And there is only one approved pattern currently. Online there are several patterns, but if you work under the Knitted Knockers brand, then you have to use this pattern for knitting and another one for crochet.
I see.
And I have been using them now, and I think it's a very nice pattern, and I don't see why. I mean, for me, I don't see a reason why there should be a change in the pattern. It's
usually just to check, how long does it take to knit a full knocker?
Well, I take around 1.5 hours.
To knit a pair or to knit one?
No, to knit one. Around 2.5 hours for a pair.
Ah, okay.
So in one day I can knit a lot because I don't have any kitchen work or household maintenance. So this is my pastime. Besides other things which I do, I keep on knitting.
So this actually keeps you occupied, and also you
very much occupied and very much satisfied also.
So it's something good that has come out.
It is very good.
Yeah. So it's from my ill health, because mummy's picked up this hobby and she feels satisfied. She's helping others. So it's a good thing for her, because otherwise her mind tends to wander around thinking of things that may be going wrong with her, about her health, about her children. So now she doesn't worry about things. She focuses on her hobbies, especially the knitting part.
Yeah, I think this should be sufficient actually. Then maybe Auntie Sadhna can show the knitted knocker, the completed one.
This is how it looks like, and then it just slides into the pocket in the bra.
So we fill it, and then this loose end we just close the knocker.
Yep. Yeah.
The wrong side, and this is the right side. Any color can be made, but somehow over the years we've seen that women prefer natural, softer colors.